May 15, 2020, we report 632 cases, 21 deaths, 3 hospitalized inpatient, 1 in ICU, 347 outpatient, 261 recovered. That gives us a case fatality rate based on confirmed positives of 3.3%. And we continue to monitor, as you can see, approaching 1,000 people in the county between our complete and actives. So in the hospital, we're at less than 1% total. As you saw, we have 1 in the ICU. So basically, the recovered 41%, hospitalized at less than 1%, 3% deceased, and 55% at home. So this is our cumulative case curve. If you remember, we're looking for that to flatten out. And then this is our daily incidence curve. So you can see a lot of there, but an overall trend definitely that's, that is down here. This is our percent positives by day. So remember, as we saw those increased, almost kind of like a double curve there. We have to account for the number of tests that are getting done every day and what percent of those are positive. And so other than a little bit of rolling around in here, you can see that that trend is also downward and has been for quite a while. So if you put that into a 7-day rolling average with the incidence as well as the percent positives on the same graph, it looks like this. We do have a little interesting uptick in percent positives in the last few days. No way to know if that is a trend or whether that's just going to be an anomaly. So we have to wait. It's hard to tell what the trend is as we move within the curve. If we look at the capital region, which is Clinton, Eaton, and Ingham counties, that 7-day rolling average, and that percent positive line looks like this. If you look at our hospitalization since April 5th, this is where we have been with Ingham County residents in the hospital. So we've been holding really steady with the exception of May 13th when we went back up to 5 in the hospital with 3 in the hospital. Currently just 1 in ICU. We had 3 in the hospital and 2 in ICU several days ago. I'm going to show you as well some information. We are, as a preparedness region, we are Region 1. So Ingham County is in Region 1. Region 1 includes Clinton, Eaton, Gratiot, Hillsdale, Ingham, Jackson, Lenawee, Livingston, and Shiawassee counties. One of the reasons I show you this is a lot of the gating criteria that are being put out there by the governor's reopen plans have to do with trends by region. Now, whether that's the MERC regions, the Michigan Economic Recovery Council regions, or whether we're going to consider it the capital region, which is Clinton, Eaton, Ingham, or whether we're going to look at the region as a whole, which has been defined this way for many years now. But I did think I would show you the hospital capacity across the region rather than just in Ingham County. So you can see in Region 1, this is our total beds versus capacity in green. And then in the capital region, the same thing. So beds total, bed occupancy, Clinton, Eaton, and Ingham County, and then Ingham County alone. If you look at ICU capacity, also you can see that we are, as a region in the capital area and in Ingham County, this is kind of where we sit in terms of our occupancy versus our total ICU beds. And then if you look at the availability of mechanical ventilators across either the Region 1, the capital region, or in Ingham County, we look like this. So lots of capacity really within our health system, both in the bed capacity, ICU capacity, as well as mechanical ventilators. So this is our zip code tracking. We continue to see 48911 here in a very high range compared to the others. The ones circled in blue, I got rid of the arrows and all the red. The ones circled in blue are the ones that have increased a range from the prior day. So you miss the other days are in the PowerPoint or the PDF that you see on our website every day. So, but we only do these for you Tuesdays and Fridays, but they are done daily. So you will see that change every day if you look at that on the website. So if you map those cases by zip code, you see the number of cases on the map looking like this in terms of those case ranges, everything from 1 to 10 up to 191 to 201. And then if we do those by prevalence, we did drop out all of the counties that have less than 20, or excuse me, all of the zip codes that have less than 20 cases. So I've been explaining to you all along that if we have less than 20 cases, that's not a really reliable number. We have so many zip codes now that have more than 20 cases. I felt it was fair to just drop off the ones that were out of that range, so that, because we know that that is not a very accurate way to calculate when the numbers are so low. But this is what our rate looks like. So certainly you see that 48911 rate in this range compared to Mason, which is in the range below, and then Okemos, as well as I think this is 48910, and then you get Lansing and East Lansing up here. Demographics of cases by sex, we're really 50-50 male and female. If you look at cases by age group, this has been the trend for quite a while now. We're going to go into some 48911 numbers since we saw those. If you look at, I'm sorry, this is a little busy. I was playing around with this and just did it. So if you look at 48911 cases by age range, percent by age range, I think it's interesting, and I don't have the Caucasians on here because I still haven't figured out how to make this less messy, and one more set of bars was going to be confusing. But the blue bars is our age range in 48911 across all races. The darker green bar is our age range in our Asian population, and then the lighter green bar is our age range in our Black or African American population. And what you can see here is that in general, as an area where this is happening, we skew to a lower age range, particularly in our Asian population. That age range is down here very young. If you look at our Black or African American population, you tend to start skewing a little bit more towards an older age range in terms of cases. If we look at percent cases by race, Caucasian 46%, Black or African American 26%, our Asians 16%, 3% other, and 8% unknown. We're fast and furiously trying to fill in those unknown blanks so that we don't have so much missing data. If we look at that in 48911, we are over 40%. Sorry, no labels on these. I missed my label. I think it's about 43% Asian, about 27% Black or African American, about 17% Caucasian, and then our other and unknown. If we look at that as a prevalence rate, where we account for the population, where we know that we have a smaller Asian population, smaller African American population than our Caucasian population. So across the entire county, our rate for Asians is 554, for African Americans 503, and Caucasians at 137. So that disparity is definitely growing on us, even in our county-wide demographics, where we were at 1.23 times higher. Now we're looking at 4 times higher rates for African Americans and Asians. And if you look at that in 48911, it looks like this. Again, I forgot to put my labels on there, but I think you're at about 3,800, 3,700 Asians. Our Black or African American is approaching 500. The Caucasians, I think that was about 127. So my apologies for not getting those labels on those bars. If we look at cases by outbreak, and I did have a legend for this, that's missing. I'm gonna have to just go past this because the legend is missing. Or did it end up down here in the bottom green? Oh, there it is. It's just hidden from me. You can see it, I cannot. So the dark blue, the 17.8% is the Meyer Warehouse. The 12% is Herbrooks. The 4.7% is the Vista Springs Long-Term Care Facility, and the 2.1% is just other, and then the rest of them are not associated with any specific outbreak. Whoops. Now, if we look countywide at confirmed cases by ethnicity, Hispanics at 9.4%, non-Hispanic or Latino at 79.2%, still trying to work at this 11.3% unknown, when our unknown and our Latin or Latino Hispanic are the same. We know we've got some work to do filling in some data blanks. But if you look at that in terms of rate, we do see a slight disparity in our Hispanic or Latino rate compared to our non-Hispanic or Latino rate. I will caution you that as soon as we get those unknowns, that 11% of unknowns in here, this could switch, because if disproportionately they're not Hispanic or Latino, that is going to change that rate. If disproportionately they are Hispanic or Latino, that's going to change that rate. So that is just something we're working on. If you look at COVID-19 deaths now, so we're talking about our deaths by age range. The 50 to 59 is 10%. 60 to 69 age group is 19%. 70 to 79 age group is 33%. And our 80 plus age group is 38% of our deaths. If you look at those deaths by sex, look at me not getting my labels on here for you again. I'm going to have to I'm going to pull that number for you in just a minute, deaths by sex in terms of the percent breakdown, but you can see it is more male than female. I just don't have the numbers on there. And then if you look at deaths by race, we are 3% African American, 62% Caucasian, percent other. So let me answer your questions, and I will, while we're doing questions here, I'll pull that number for you.
Oh, here's my meeting. All right, talk to you later. Bye-bye.
Does anyone have any questions?
That is, by the way, 57% males and 43% females.
Go ahead, Megan.
So we've heard some experts say that, I mean, you know, the local and statewide death counts are likely underestimated. And we're wondering, there's, you know, a lot of talk about post-mortem testing. Mm-hmm. If that was done more often, do you think that that would lead to a more accurate picture of deaths?
I think that that varies by community. So I can tell you that in this community, there already is post-mortem testing going on. And there already is testing. Anybody that goes into the hospital, for the most part, is any hospital deaths are getting tested. So broadly, and then again, funeral home directors as well as our medical examiners are supposed to be doing testing. So I reporting here. I do, however, have some information from death certificates on file at the clerk's office. And we're doing a little bit of digging. We're looking at criteria, you know, for COVID-19 that might have been present in all those deaths, see if they were tested or not tested, look at those symptoms, date of onset, those sort of thing, and to see if any of those have any likelihood of being COVID-19 deaths. So it might be something like sepsis, because sepsis happens a lot of times with pneumonia. Those are kind of some things that might be on a death certificate that right now you'd look back at and say, we need to double check that and see if maybe there was anything COVID-19. So far, we have not missed any that we've been able to look for. The medical examiner's office kind of did the first pass through on all of them that I got from the clerk's office. She went back to early March and pulled anything that just, you know, and she's not a medical person, pulled anything that to her looked like, you know, maybe this could be, and sent it to us so that we could look at it. The medical examiner in Sparrow Health System has already gone through them all, and that's where the vast majority are. So at this point, we're just, you know, cleaning up a few additional ones.
If anyone has a question, feel free to jump in.
It's a quiet day.
I have a question. It's Rachel from News 10.
Hi, Rachel.
Hi. So churches will start opening up on Monday in the Lansing area. Is it a reasonable strategy to have a 5% capacity at the church? And is there a better way to do it to keep people safe while going to church?
I think capacity is the best way to go in terms of restricting the number of people. You know, I've said since, you know, way early on when we were talking about, you know, bars in East Lansing before we closed down, that a number, you know, the number 50 or the number 250, I mean, we've seen so many numbers in terms of capacity that doesn't work. So the best thing to do is to look at what your fire code capacity is and go by a percent of that, you know. And so then we have to do a lot of calculations of what percent of capacity allows us to, you know, fairly consistently stay 6 feet apart. So definitely the lower end of capacity limits right now, as we're first starting to go in, is advisable. And then other precautions, I mean, clearly, even though you limit the capacity inside, people will do what people do. So, you know, people need to be reminded about hand washing and not shaking hands and potentially wearing masks and all that sort of stuff. Because now we're talking about people in a public space with, you know, a number of other people, even if they've limited the capacity to a large extent. So there are additional precautions that people certainly should consider.
Okay. And then a follow-up question to that. About the mysterious virus that is killing children, should people in this area or in our county should be worried about that?
Okay, so it's not a mysterious virus, I don't think. I think that what they're saying is there are some COVID-19 positive children that have kind of a mysterious cluster of symptoms. A lot of it is Kawasaki disease, like some inflammatory processes, things like that. Kawasaki disease is very rare, and this also is very rare. I mean, it's kind of hard to see how rare it is because there's so few children impacted, you know, the younger age children. So there definitely is, the CDC did put out a health alert on that so that we can start looking for that. I haven't seen any of those kinds of cases in Ingham County yet. I don't know that we've seen any in Michigan, but we do know that, like New York, where they have lots of cases, they've seen a few. I think there was some studies that I think they picked up a few in France, I'm pretty sure is where it was, someplace, France or Germany, as they were doing studies related to it. So it is definitely something to keep an eye on, but it's not a new or a strange virus. I believe what it is an unusual presentation of symptomology as a result of COVID-19, maybe consequences of, you know, the infection on the body rather than directly the impact of the virus. I think all of that is being kind of looked at right now in terms of what's going on. But, you know, it's a similar thing to, you know, when you talk about children in Rye syndrome and not giving children with high fevers aspirins. I mean, we always have to watch our kids when it comes to fevers and things like that, because, you know, there are times when just these, you know, unusual presentations that we know exist out there and at the same time are rare can happen. So sometimes these are the consequences of some other viral diseases too. And I think that we're just trying to figure out what's going on.
Okay. Thank you.
Mm-hmm.
Does anyone else have a question for Linda?
I have one more if nobody else has one.
Go ahead.
About school, I know I asked this earlier this week about schools opening in the fall, but the governor mentioned that it's going to be opening hopefully open in the fall. Mm-hmm. Is there anything that you think should be included in this plan?
Are you talking about universities or are you talking about public schools? Because the last time we talked about it, we were talking about universities.
Yeah. Public schools and universities, on your thoughts on that?
Well, I mean, everything regarding reopening right now requires a lot of planning, you know, so everything is shut down to open the doors up and go back to the way we normally operated. So working with the courts right now on that. The universities will have to go through lots and lots of planning. What are the, you know, physical controls, environmental controls, personal protective equipment, all of those kinds of things that we can put into place to keep people safer. How do we keep class sizes down? How do we keep, people from being too close to each other? How do we make sure that people have the proper access to things to wash their hands? How do we make sure that they're educated about hand hygiene, staying home when they're sick, and also screening? Screening's going to be important, as we continue to go on, and then also, of course, testing. But with regards to the school in particular, it's going to have to be very cautious because, that tends to be a fairly crowded and dense situation when you put a lot of kids into a classroom together. You start to talk about the public schools, and public schools don't have the luxury of going down to 5 or 10 person class sizes. They're going to put 20 or so kids in a class, and then what does that mean, and what does that look like? How do you take precautions? How do you perhaps look at when we closed down? When we first started closing down, one of the first things that happened in schools, if you look at the public schools, not the universities, was the suggestion that maybe they don't go into the cafeterias. They serve food in their rooms. They, the libraries, the cafeterias, the sporting events, those kinds of things. So even the start of school will require looking at the contextual, aspects of going to school related to all of those other things. And how do you make sure that you deliver the learning and not take on unnecessary risks, like lots of kids in a cafeteria, lots of kids in the library, sporting events, those sorts of things. So it's all, I wish I had answers. I don't have answers to all those questions.